Hello everyone and welcome to this audio podcast and this audio podcast series, the LabTronix series. This is the Shientist, and today I'm going to be providing an overview in context of nephrology around renal and nursing. This is an audio podcast that is a collaborative between the RPSG and KDARS. It's an RPSG and KDARS collaborative. It's a part of the Ballistix Edition, and it's another Storm Robotics production. So in context of nephrology and nursing practice, practice aims to optimize patient care through improved communication, a systematic review of barriers to care, and developing strategies to address those barriers. There's works published by Nehart that highlight a nursing practice model which has developed to encourage and support self-management amongst those who are amongst those in the nephrology or CKD population. Also in line with this, works by Nehart and team in a little while ago in 2010 retrospectively highlight that different models of care allow to identify specific barriers to quality and patient care, and how those can be impacted. Structures are set up to structures set up the expectation and means of communication and aspects of integration between all points of care for patients from early CKD through and up until different forms of renal replacement therapy, and different nursing practice models can provide patients with greater with support around aspects aligned to the educational aspects, as well as the efficiency around how to navigate different aspects of nephrology or renal the care of CKD patients is and can be quite complex, and generally it can require continual assessment, planning, intervention, and patient education or educational support. Nephrology nurses, nephrology practice or practice nurses have assumed more responsibility in the care of CKD patients, and nephrology nurses take part in the recognition around CKD at earlier stages around CKD, and in aspects of prevention surrounding end-stage renal disease. And it includes labor-intensive monitoring, education, and coordination of different aspects of healthcare, renal care. Now, also in line with this, and specifically surrounding clinical practice, nursing practices are aligned more specifically around chronic kidney disease clinics, anemia-based clinics, vascular access-based clinics, renal replacement initiation, and diagnosis, and part of diagnosis and evaluation. Nurses generally manage all clinics to ensure that the patient's patient needs are generally met. And in context of clinical practice, there's an element of promotion of self-management, and so what this means is promotion of disease self-management can be an important topic underlying the principle in the care of any patient with chronic illness. And so patient education generally is a crucial part of the understanding in aligned to diagnosis and treatment options. Patients must also develop a broad understanding of managing symptoms and treatment regimens. And the earlier patient education occurs, the greater the opportunity for showing for slowing disease progression and making informed decisions can be. And again, works by Nehart sort of highlight some of this as well. Um, the goal or one of the main aspects surrounding patient, or some of the aspects surrounding patient self-management, is to maximize patient participation in self-assessment, monitoring, providing an overview around specific medications, treatment, administration, evaluation of therapies, physical and psychological health promotion if and where that may be required, and prevention of complications or health complications, improved adherence to sort of medical regimens, and also to inform and in context of a collaborative approach between different professionals, the sort of care and treatment plan for different patients undergoing different forms of renal replacement therapy, or RRT. Now, the barriers to this, or the barriers to patient care in context of nephrology and nursing, can be, for example, for example, where a patient may have a placement of vascular access that might be inappropriate for dialysis efficacy, so that can present as a barrier. Inadequate preparation for renal replacement therapy, lack of integrated practice in nephrology, delays in requests for nephrology consultation, unnecessary admissions and inappropriate utilization of emergency room type settings, inefficient discharge planning, and poor communication with outside service providers. So some of the ways that barriers can be removed. For example, a nursing practitioner functions at least in apart from quite a few ways. A nurse practitioner functions as a liaison between the admitting service and the inpatient in and around renal replacement therapy regimens, and the outpatient clinics. Now, a nurse practitioner generally is a health professional in communication with between in and outpatient settings, as well as in between different healthcare sectors, as and where that can be a requirement. Now, adult and pediatric, for example, transplant specialist nurses tend to visit in between different hospital settings, and also assist with the continuity of care back to the outpatient setting as well. So, see, some of these ways are ways to remove barriers in nephrology care. And also preparation for in aligned to renal replacement therapy, preparation for forms of renal replacement therapy, including hemodialysis, includes a functional to understand and to ensure there's functional access. There's patient education, obtaining required laboratory investigations from in context of pathology and laboratory medicine, clinical clearance in understanding in ensuring that patients are aware of different aspects surrounding laboratory parameters, at least where for example, a patient-facing or frontline practice perspective, and also in some areas of nursing or nephrology practice, nursing practitioners would have a link with aspects of financial paperwork in some aspects as well. Patients sometimes are not adequately prepared for different forms of renal replacement therapy in the outpatient setting, and so thus a nurse practitioner's involvement in preparation for where patients will be, or where patients are required, where patients are being worked up for different forms of renal replacement therapy, for example, then generally the nurse practitioner in context of nephrology practice has involvement in between different settings in this regard as well. In context of patient education, although I've sort of mentioned this a little bit in one of the previous slides, this slide is sort of an overview. So in context of patient education, as patients become more autonomous, more skilled, they can and are able to be perhaps more proactive in and involved in decisions regarding aspects pertaining to their healthcare, and patients who become experts and managing clinical and medical aspects surrounding their conditions are more able to have sort of those important links into general aspects in line to work and routine and day-to-day. For example, as CKD patients in particular must have sort of transparency and understanding of all elements of disease management and be able to function sort of independently and again autonomously to generally be successful. And much of this much of the aspects surrounding to at least frontline patient education does actually involve more in context of nephrology practice, the nursing practitioners more so than the clinicians themselves, and not to say of course that other health professionals also have an involvement in aspects of nephrology practice as well. And generally, nephrology, as I'm sure many would be aware, is sort of multidisciplinary. So I'm now going to sort of end in this overview, and just to highlight once again that have a few acknowledgements, and I will just list them out, that information here, and once again I say thank you for tuning in on this audio podcast on renal and nursing. And once again, this has been the Shientist, and it's been another Storm and the Ballistix production around in and around the Ballistix Edition, and as part of the LabTronix series. Thank you for taking the time.